in the hospital, you were in an auto accident on your motorcycle. Do you remember what happened during that accident?
No, I
Not at
don't.
all. Do you have any pain?
Yeah, I have a headache.
The headache? Can you point to it for me? Okay, do you know when that started? Can you remember?
As soon as I woke up, I had a headache.
What makes it worse?
Just light. The light's kind of giving me a headache.
Okay, does anything make it better?
No.
No? Okay. Can you describe the pain? Is it dull, sharp, stabbing, burning?
It's kind of just a dull headache.
A dull pain? Okay. Can you rate it on a scale of 1 to 10, 0 to 10, 0 being no pain, 10 being the worst pain imaginable?
I'd say 5.
Is this an acceptable pain for you?
I guess, yeah.
It's just, okay. Is it different from any other headaches you've had in the past?
Yeah.
It's a little bit different. Do you have any dizziness or nausea?
I'm a little dizzy, but I'm
A
not.
little bit dizzy and nausea, that's good. Have you ever experienced any seizures or fainting before, if you can remember?
No.
Do you have any tremors in your face or hands right now, or your feet? No? Do you feel weak at all in any of your hands? Do you feel weak? Do you feel like you can lift them up?
Yeah.
Yeah, no problems? What about coordination? Do you feel like you can tie your shoe?
Yeah.
Okay. Do you have any numbness or tingling?
No.
Or any difficulty speaking or swallowing?
No.
Does it hurt to swallow at all? No? Are you on any medications?
No.
Not right now. Do you have any allergies to food or medication?
I'm allergic to penicillin.
You're allergic to penicillin? Okay. Have you ever had a stroke before?
No.
What is your occupation?
I'm an accountant.
Accountant, a desk job. Do you have any other environmental or occupational hazards?
No.
No. Have you ever been hospitalized for a head injury before?
Mm-mm.
No. Do you have any family history of strokes or seizures?
No.
Do you have any history of mental health or anything? Do you have any family history of mental illness? No. How often do you exercise?
Like 3 times a week.
3 times a week? What kind of exercise do you do?
Usually I just go for a run.
Go for a run? Do you have any alcohol use problems?
No.
Do you smoke cigarettes?
No.
Or use any other drugs recreationally?
No.
Do you take any safety precautions in your life? Do you wear a helmet when you ride your motorcycle?
Yeah.
Or in seatbelts when you are in a car?
Yeah, I usually just ride my motorcycle.
Okay. Do you wear leather when you ride your motorcycle?
Nah.
No? Okay, well that's all I have for you. The other nurse is going to come in 1 minute to do a physical assessment. Thank you.
The nurse is examining the patient's appearance, behavior, which includes the level of consciousness, speech and mood. She is examining the patient's cognitive function and their thought process and perception.
Knock, knock. Hi there. My name is Brooke. I'm going to be your nurse. I'm going to do your physical assessment, okay? Can you tell me your name and date of birth?
Ralph Waldo, October 14th, 1990.
All right. And do you remember what happened?
No.
No?
Don't.
Okay. Can you raise your arms up for me? Okay. Thank you.
Now the nurse will assess the 12 cranial nerves. First cranial nerve 1, to test for olfaction.
Can you smell this for me?
Yeah.
What does it smell like?
It smells like alcohol.
All right.
Next is cranial nerve 2, optic.
Can you please read this line for me right here?
OKHDNRCS.
Okay, great.
Next is cranial nerve 3, 4, and 6 to assess the eye motor function. She will also use the pen light to see if the pupils are equal, round, and reactive to light and accommodation.
All right, look at my finger. You're going to follow it with your eyes, okay? Okay, now I'm going to check your pupils, okay? You just look straight at me. Okay, pupils are round and reactive.
For cranial nerve 5, the nurse will see if the patient has sensory function of the ophthalmic, maxillary, and mandibular regions.
All right, you're going to keep your eyes closed for me, okay? and you're going to tell me if you feel a dull or a sharp pain, okay?
Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay, great.
Next is cranial nerve 7.
All right, can you smile for me? Okay, can you blow air into your cheeks for me? Okay, and then can you lift your eyebrows for me? Okay, great.
Next is cranial nerve 8. For acoustic, she will assess the external ear shape and size and tenderness. She will use the otoscope to look at the external canal and tympanic membrane. If needed, she can also use tuning forks to test hearing.
Okay, I'm going to whisper in your ear, okay? And in both ears, and you're going to tell me if you can hear it or not, okay? Okay, so you heard?
For cranial nerve 9 and 10, the nurse will assess the patient's ability to swallow and look at the uvula.
Okay, can you swallow for me? All right, can you open up your mouth for me? Stick out your tongue. Okay, your mouth is moist.
Next is cranial nerve 11. The nurse will assess the patient's spinal accessory muscles and look for equal strength.
Okay, so I want you to push against my hand as hard as you can with your head. Okay? I want you to push against my hand. There you go. Okay, now try and lift your head up. Okay, now push against my hand. Down. Okay. Now, can you raise your shoulders against my hands? Okay.
Lastly, for cranial nerve 12, the nurse will assess the patient's tongue motor function.
All right, can you say light, tight, dynamite to me?
Light, tight, dynamite.
Okay.
Now the nurse will assess the patient's motor function. She will look at the patient's muscle size, assess strength and tone. She will look for any involuntary movements and will look for symmetry.
All right, I'm going to put my hands on you just to feel around a little bit, okay? Okay.
Now the nurse will assess the patient's cerebellar function. She will assess the patient's coordination and skilled movements and then balance.
All right, can you pat your knees like this, please? Okay. Can you touch my finger? Okay, can you touch my other finger? There you go. Okay, can you touch your nose with your finger? How about other hand? Okay. Can you stand up for me, please? Oh, well, okay, all right, you're going to sit down again. All right, let's get you back in bed.
Now the nurse will do a sensory assessment.
All right, I need you to close your eyes for me, please. There you go. All right. Can you tell me where I just poked you?
My left arm.
Okay. All right, and then can you close your eyes again for me, please? Can you stick out your hand? Can you tell me what you're holding?
Paper.
Okay, great.
Now the nurse will test some of the patient's reflexes. If reflexes are hyperactive, the nurse will test for clonus.
All right, I'm going to test your reflexes now, okay? Okay, that one's good. Does that hurt you at all?
A little, but it's okay.
Okay, that one's good. Okay, reflexes are good.
Hi. I just wanted to make sure that we want to make sure that you don't fall here in the hospital. So I just wanted to make sure that you know that your call light is right over here. And I want you to push this button when you want to go to the bathroom so that we can help you assist. And if you want to get up and do something. So we're going to put your bed alarm on. So if you get up, it's going to beep. So just press that button and you're good. All right? Do you understand that? Can you show me how you can press it? All right, perfect. Thank you.